ladies, I'm Barbara and I am your menopause drama mama. If you are new to my channel, I welcome you. Today's video is all about getting that skin healthier on your face because we lose so much of the collagen loss after our menopause years. Our skin gets so much thinner, especially mine right underneath here, very thin. Our skin is more dry and dehydrated. We have a longer time period for our cell turnover in our faces and inflammation. So there is, I'm talking dermatologists. Now this is all on dermatologists. This is what they recommend. So the number one thing is the retinols, and the number one is you can get the prescription. I do have tazarotene cream, which is 1%, and I also have the retinol gel. I prefer the cream on my face, and I always use a moisturizer also, only because of the irritation. So I kind of trade off every other day. So one night when I use, my tazarotene cream, the next night I'll come in with a copper peptide. So I give my skin a break for a day before I put my retinol on my face again. And this will definitely, number one is the ingredients here, will help boost your collagen the quickest. It'll help soften your wrinkles, improve the crepey skin that you may be experiencing. It will help thicken that thinning skin, and it will help your pores and the texture of your face. If you do not want to get a prescription drug or a prescription, for your face, dermatologists recommend that you can get the CeraVe Resurfacing Retinol, the La Roche-Posay Retinol B3, or the SkinCeuticals Retinol. And those are all over the counter. So you can just go into, any store, Target, Walmart, or whatever, in their facial products. Look for those products if you don't want to get a prescription of the vitamin A or retin A for your face. And they will help. It'll just take a little longer, but it probably will not be as irritating as a prescription on your face. The second thing that will help the most is peptides. It is one of the best menopause-friendly ingredients because peptides help support the weakened skin structure. It will help improve your firmness on your face. It will help support the collagen signaling to build more collagen in your face. It will help with the sagging and around your, the bottom part for your jowling. It will help improve the skin barrier, and it is gentler than any retinoid. So that is the next one. So that would be like a copper peptide. So like I said, I use one night a retinol and the next night I use a copper peptide on my face. You can also use Matrixyl and also a multi-peptide formula. But I personally, so far, I like this. This is the one that I am using. I like this one a lot. It has a very nice scent to it, very light scent, not overpowering or anything like that. So, but dermatologists love the brands of the peptides in the ordinary, which would be the multi-peptide serum. Olay, oil of Olay, has the peptide moisturizers also, and Revision skincare peptide products dermatologists recommend. The third thing to always use on your face is a hyaluronic acid, and menopausal skin loses so much water, much easier than we did before we went into menopause, so hydration becomes critical at this point. The benefits of hydrating your skin is it's going to plump the skin. It will help reduce that tightness. It will help fine lines look softer and support the moisture retention in your face. Hyaluronic acid works best when sealed with a moisturizer, And the great options that dermatologists recommend are the Vichy Mineral 89, Neutrogena Hydro Boost, and the La Roche-Posay Hyalur B5. So those are the three that dermatologists would recommend for you to use in your hyaluronic acid. Number 4 is ceramides, another really important one to use because it has the ingredients after menopause to help the skin barrier since it weakens. And the benefits of ceramides is it will help repair your dry skin barrier. It will reduce irritation on your face. It will help decrease your water loss, and it will help skin feel less thin and fragile. Dermatologists will recommend or highly recommend for ceramides the CeraVe Moisturizing Cream, Skin Fix Barrier Creams, and Dr. Jart Plus Ceramidin. Those are the top brands of ceramides that a dermatologist would recommend for you. The 5th thing is using a vitamin C. I always do because it is excellent for the menopausal dullness and collagen production in your skin. It will help with those issues. The benefits of vitamin C is it will help brighten your skin. It will help support your collagen production. It will protect your skin from environmental damage, and it helps the uneven skin tone that you may be experiencing. Dermatologists often prefer the L-ascorbic acid form, the THD ascorbic, which is a gentler oil-soluble form. And the brands that they most recommend are SkinCeuticals CE Ferulic, Timeless Vitamin C, that's the one that I use, or Paula's Choice Vitamin C. Number 6 is a niacinamide. Always want to use that also. It is menopausal friendly on your face. It will help with your aging and any sensitivity you may have on your face. The niacinamides will help improve your barrier function. It will help reduce any redness you may be experiencing on your face. It will help minimize the pores. It will help uneven tone, and it will help improve your skin elasticity. Usually 2 to 5% you want to get in a niacinamide if you have really sensitive, mature skin. And the best choices that a dermatologist uses are the Paula's Choice niacinamide or the Naturium niacinamide serum. The 7th thing that a dermatologist will tell you to use every day is sunscreen, which you would put on after everything, all your products that you want to put on. Then come in with a nice sunscreen. I love the Mineral CeraVe. It's the medium tone, so it just gives a nice look on my face. And, then it's already, I don't have to use a colored foundation because it's right in my mineral sunscreen. So dermatologists consistently say sunscreen is more important than any other anti-aging cream. The skin at this time becomes thinner faster, the collagen breaks down easier, and the pigmentation becomes more common in your face, so that's why they say you have to use a sunscreen. The Mineral Hybrid SPF 30 to 50 you can use for your face on your sunscreen, and mine is the Mineral, SPF 30 CeraVe. So I love it every single day wearing that, putting it on in the morning. Dermatologist favorites are the Ulta MD UV Clear, the La Roche-Posay Anthelios, or the Color Science Flex SPF. Now, you don't have to use all these different brands that they suggest, but I'm just telling you from a dermatologist point of view, this is what they would say to use for the best, ingredients on your face. And also, dermatologists often recommend less after menopause, so don't do hard scrubs on your face when you're cleansing. Don't use high-strength glycolic acid every day. Excessive exfoliation. Now, I like to try and do maybe once a week for my exfoliating. Don't use heavy alcohol toners anymore, or overly aggressive acne treatments that will only stimulate more issues going on your skin. The menopausal skin does much, much better with a barrier repair, a hydration, collagen support, and gentle renewal. So what a dermatologist, if you went to go see a dermatologist today, that what they would recommend for your morning and your nighttime routine would be in the morning, use a very gentle cleanser, put on your vitamin C, use your peptide or your hyaluronic serum, a ceramide moisturizer, top it off with your SPF sunscreen. At night, they would say use another cleanser on your face. I like to do the double cleanse at night. So I will come in with like a balm and then cleanse that off. And then I come in with like a milky cleanser. So it'll keep my face moisturized. And I don't want to strip anything off. So use the double cleanse at night if you have a lot of makeup on. Number 2, use your retinol at night. Use a peptide or barrier cream. And number 4, moisturize. Always moisturize that skin. So the simplest things are for your face in a quick recap is your retinoids, your peptides, your ceramides, your vitamin C, and your sunscreen, ladies. That is what is going to help you rejuvenate your face, get back some of that youthful look, to soften some of your wrinkles, some of that sagging. And I'm just going to throw in, because I know dermatologists are doing this now more, to come in with just using a derma roller on your face to help you also. So ladies, I hope you enjoyed the video. I will always talk to you, very soon. I try and put out as many videos as I possibly can. It's all for you, because I've been on this journey for 12 years now. Post-menopause, 12 years. I am 62. And I try and do as much research as I possibly can for you and for me, because I will live in this state as long, and like you too, for the rest of your life. We can't get out of menopause. We're staying right here, just like when we went through our puberty years. It's just another stage of life, ladies. So we might as well make the most of it and look our best in the meantime. So I hope you're having a fantastic day wherever you are in this world. Always sending blessings to you, high vibrations, and I will talk to you very soon in my next video. So hope you're having a great day wherever you are. Love you, ladies. Bye-bye.